Hello, I am Dr. Mel Hauser. I use she, they pronouns, and I am a family physician and executive director of All Brains Belong Vermont. We are a nonprofit medical practice in Vermont caring for mostly autistic and ADHD patients. This population experiences a constellation of multiple related chronic health conditions.
There's literature linking, a number of chronic health conditions to autism and ADHD. There's also literature linking each of these components to other components of the constellation. And zooming way out, when we think about the holistic pattern of autistic and ADHD physiology, these medical conditions all fit into a unified constellation. So these are examples of chronic medical conditions that are more common in autistic and ADHD adults, including hypermobility spectrum disorder, POTS dysautonomia, irritable bowel syndrome, chronic pain syndromes, obstructive sleep apnea, myalgic encephalitis, chronic fatigue syndrome, migraine, long COVID. And we know that the components of this constellation relate to one another. As one of my patients said, it's like a ball of yarn, that if you pull the wrong string, it makes the knot tighter. Often, when these medical conditions are evaluated and managed as separate components, for example, like treating POTS by itself or treating chronic pain by itself, often some of the standard management of this constellation makes some of the other parts worse. What this project is about is zooming way out and presenting the constellation as a whole and sharing some resources. And this is important because autistic adults have a life expectancy of 36 to 54 years, with premature cardiovascular disease and suicide as leading causes. ADHD adults also have higher rates of chronic health conditions and reduced life expectancy. And since this constellation of medical problems and its impact on autistic and ADHD adults is an area of emerging research, what we've done here in this project is consolidated the currently available information all in one place, in addition to summaries of focus groups with autistic and ADHD adult patients. This information has also been reviewed and vetted by a review team of primary care physicians. We hope you'll find this helpful.